women of color, and particularly Black women, are 3 to 4 times more likely to die from pregnancy-related complications than white women. That, in my opinion, is a pandemic. That is an epidemic, right? That is a crisis.
Wow.
That is a
3 to 4 times more
more
likely not to survive childbirth,
and this is up
which,
to first
wow.
year. So pregnancy and pregnancy related complications. So whether it's childbirth, whether
Okay.
it's a month later, 2 months later, 5 months later, up to a year later. So
Okay.
perhaps I'm going to my doctor and I'm saying these things and this isn't happening. And there was a heart issue now that wasn't caught, or,
Mhm.
um, you know, any of those types of issues. Was there a maternal mental health issue? And now we are seeing, and I don't know how much I can say without getting it censored, but people wanting to unalive themselves, right? Uh,
Yes. Yes.
so we think about that. We have to look at that. And so being 3 to 4 times more likely, that is and this isn't just in lower income populations, because I want to always clear that up, because if you're reading certain research or certain bodies of literature, what you will hear and see, excuse me, what you will hear and see is, oh, well, we're looking at education, we're looking at insurance status, we're looking at housing, we're looking at weight and different social determinants of health. We're looking at all of these things because those things would say, oh, well, if you don't have a decent or quality education, you're less likely to have a decent job. If you're less likely to have a decent job, you're less likely to have quality insurance. If you're less likely to have quality insurance, you're less likely to have access to quality providers, right? That's the way it would go. So when we understand that these women are still dying at higher rates despite all of that, when we remove,
Mm,
right? So when they are overeducated, when they
mm.
are scientists, work for the CDC, when they are in HR, when they are bankers, when they have all of these, what society would consider a good job, right? Which means they got some, what society would consider good insurance, and have access to quality professionals, they are still dying,
It's still dying.
still dying. You can
So those
go,
variables that we think would set you up
yeah, would set you
for
up
a
to be
different
at a higher
outcome.
rate. Yeah, put you at a higher risk.